And while I have been educated in the school of modern medicine, the epitome of scientific knowledge, I cannot deny the energy I feel emanating from the spirits of those who are ill, and from that which dwells deep within me. I soften my eyes, I relax my ears, I quiet my mind and allow the energy to permeate my very being. The spirits raise my skills to a higher plane.
And I awaken to my true self. Oh, it's no use. I can't understand any of this. It says the five-pointed star is a symbol of life. But when I look at it, it simply reminds me of a piece of okra in a bowl of gumbo. I guess the healing touch just isn't for an ordinary person like me.
This door's no good. It's been totally warped by the snow. I guess it can't be helped. This hospital isn't exactly new.
Well, this door isn't used very often, so it shouldn't be a problem.
I suppose we should still call and have it repaired. Is something wrong?
Oh, my stomach.
Director?
Let's see. Your amylase count is good, your pancreas is functioning normally, your white blood cell count is fine, and I don't see any problems with your immune system.
Well, that's good to hear.
Just let me know if you think you're recovering too quickly. I can change some of these numbers and extend your vacation.
No, that's okay, Doctor. I'd like to return to work as soon as possible. Although, once I've fully recovered, I do have another favor to ask.
Marcus! Director Hoover just collapsed!
What?
He has multiple tumors in his small intestine, and they've already reached a fairly advanced stage. I've stabilized him with an IV and a blood transfusion, but he needs to be operated on right away.
Why did he let his condition get so bad?
If only he had taken better care of himself. He kept all his troubles and worries bottled up inside, not wanting to burden anyone with his problems.
Standing around wondering why won't do him any good. We need to focus on the procedure.
I won't let him die. Let's begin.
Let's begin the operation. The tumors are located in the small intestine. Good luck. The area is a little... Use the syringe to inject the anti-inflammatory directly into the inflamed area.
Inflammation treatment complete. Let's continue with the remainder of the operation.
We found a tumor. Let's use the Powell procedure here.
The tumor has been removed. Please treat the area where you made the excision.
It looks like that's everything, but his vitals aren't stabilizing.
I wonder if the preliminary scan missed anything.
I'm preparing the magnification tool. Use it to search the area thoroughly.
There's one over here? It's progressed much further than we expected. We need to extract them all.
The tumor's been extracted. When we're done here, we should check out some other areas.
The vitals! The vitals!
Signs of tumors are decreasing. It spread much more than we anticipated. There are no further signs of tumors. Please remember to treat the remaining areas. His vitals are stable. I think we're okay now. I was pretty worried at one point, though. Please close him up. The operation is complete. I'm sure the director will recover quickly. Great work, everyone.
Well, we were able to remove all the tumors from your small intestine, sir. You should be up and around in about a week or so, but...
But it is unclear whether or not the procedure was successful, yes? My mother also suffered from tumors. It appears the apple doesn't fall far from the tree.
Sir, I strongly recommend that you take some time off to recuperate. Perhaps you could undergo treatment somewhere in a warmer climate.
I appreciate your concern, Dr. Blaylock, but I've already made up my mind. As you know, I have been planning to close this hospital for some time now. Dr. Vaughn, Dr. Blaylock, you two should return to Concordia. Say, have you heard? They're building a new university hospital in Fairbanks. Knowing that a top-rate facility will be located nearby makes my decision much easier to live with. This hospital and I have grown old together. I believe it's time for both of us to retire.
Congratulations, you're recovering extremely well. I don't see any problems with your pancreas. You're free to return to LA whenever you're ready.
Have you thought any more about the favor I asked? I'd really like to go with you and assist you in the OR.
You don't give up easily, do you? Sorry, but the answer's still no. Trust me, I have my reasons. You don't owe me anything. You need to think about your future.
That's why I'm asking. I want to train alongside the world's best surgeon.
I don't think you want to put your fate in the hands of a doctor who's about to lose his job. Go back to Concordia. You owe them an explanation.
This may be the last time I walk these streets. I can't believe the hospital is actually closing. It's all so sudden. Well, I may not have made any major medical breakthroughs, but coming here wasn't a total waste. I suppose I'd better start thinking about what hospital I'd like to work at next. Oh, I almost forgot. I was gonna go get some coffee at Jake's. It's the hospital. Hello?
Dr. Blaylock, are you nearby?
Yes, why?
There's been an accident at the construction site. We need your help.
I'm on my way.
Val! Over here!
Where's the injured party?
She's in no condition to be moved. We'll have to treat her at the scene. She's lodged beneath the frame of the church. Our equipment's already been loaded onto the helicopter.
Elena!
Dr. Vaughn, please let me come. I know I can help.
I can't let you do that. You're still...
I'm fine. You've seen to that, Doctor.
We can't waste any more time. We're taking off.
Come on, Elena. It's better to be safe than sorry.
Suit yourself, but it's your life that's on the line.
I'll take my chances.
Sister Catherine!
Oh, Dr. Blaylock. My chest. I can't.
Don't worry, sister. We'll get you out of there.
It's no use. The frame's too heavy. We won't be able to move it.
The pain is unbearable. Oh, Lord. Please. Help me.
Don't give up, Sister Catherine. That's what you told me when I was...
It's risky, but we'll have to leave her where she is for now. Elena, get the instruments and anesthesia ready.
Okay.
She's suffering from a chest contusion and cyanosis. We need to open her up immediately.
All right, Valerie, you take the lead.
Her chest must have been compressed when she was caught in the collapse. Her heartbeat sounds distant. She may be suffering from cardiac...
If that's the case, then blood will collect in her pericardium and cause diastolic heart failure.
We don't have time to train...
I can't believe we have to perform a thoracic surgery in a place like this. Let's hurry and operate so we can get... Please treat the external injuries before we move. All external injuries have been treated. Quickly, open her up. Use the ultrasound to locate pockets of blood while treating the other wound. There's hemorrhaging inside the pericardium. Make an... If there are multiple... The pericardium tore again. Please treat it quickly. Doctor, the pericardium! Drain the blood and suture the tear, quickly! Please suture the incision closed before it begins hemorrhaging again. A blood pool has formed more blood. Please drain it once more. Hemorrhaging within the pericardium is complete, but her vitals aren't stabilizing. There must be another hemorrhage somewhere. Doctor, keep using the ultra. If we let it go on for... Immediately make an incision with a scalpel when you find out where a hemorrhage is. The pericardium has been sutured. Please make sure that there aren't any more hemorrhages.
Should we risk carrying her out now? Her vitals are still unstable, but...
You're right. Considering her condition, it...
This isn't good. Was there another collapse?
No! Sister! If I can't save her life, I have no business calling myself a doctor. Spirit of life, guide my hands. She'll be okay now.
Don't tell me. What was that?
Please close her up, Doctor. We can transport her to the hospital for the time being. We can perform any remaining treatments there. Well done, Doctor.
We were finally able to free Sister Catherine, so I'm going to transport her to the hospital now.
All right, let's head back then. She's made it through the worst of it, but we still need to watch for signs of crush syndrome.
I'll monitor her condition.
You did it, Valerie. I knew you had it in you, but I never imagined your gift would awaken so suddenly.
I'm actually surprised myself. It wasn't the technique that was important for the healing touch. It was the opening of my heart. I finally understand what Dr. Montgomery was trying to say in his book. It was a difficult operation, but I want to continue working as a doctor.
Yeah, I guess I've got some thinking to do myself.
Have you finished packing?
Yes, just now.
I apologize for being so selfish.
No worries. This is the hand Faith's dealt us. As long as I remember that Concordia is just a stepping stone, it won't be that bad.
But what about all the staff members here? What are they going to do?
Oh, don't worry about us. We were able to negotiate a deal with Fairbanks Hospital. Everything is going to be transferred there. All of our patients, staff, and equipment. However, we may have a shortage of world-class doctors.
My daughter and family have offered to look after me, so I'll be going to Seattle. The warmer climate should aid me in my recovery.
If you happen to relapse, please contact me immediately. I'll drop whatever I'm doing and come operate on you.
Thank you, Dr. Vaughn. But I'll do my best to make sure you won't have to.
I gave Concordia a number of conditions under which Valerie and I would return, Elena. The most important being that you would be our assistant in the operating room.
Dr. Vaughn!
We expect nothing less than your very best. When I first arrived here at Montgomery Memorial, I absolutely hated it. But it's true. The greater the challenge, the more you appreciate the experience. Dr. Hoover was a strict but amazing teacher.
Val,
Yes?
the operation that the professor is asking us to perform will be extremely difficult. If we're going to be successful, we'll have to work together.
What are you saying, Marcus? Of course we will. We're a team. A team that has endured the harshest of winters.